I'm Laurel Pracht with the Patient Advocate Committee with NRG Oncology. And today I'm going to interview Dr. Deborah Bruner and ask her about what their expectations are of advocates and how we can help with each of our committees. Dr. Bruner, I'd like to ask you about what are your expectations of an advocate and how can we help improve communication between the advocacy committee and the committee chairs.
Well, thank you, Laurel. Hello, everyone. I'm Dr. Deborah W. Bruner. I am one of the multi-PIs of NRG NCORP NCORP. We've long worked with our patient advocates, and they are absolutely key to our concept development and certainly to our concept review. We count on advocates in every way to talk about, number one, when we're thinking of concepts, what's important to patients? Number two, when we have a concept, is it feasible? Is it something that a patient would want to do? Sometimes we have great research ideas that an advocate might look at and say, that might be a good research question, but as a human being, I would never want to sign up for that trial. You're asking me too much, you're asking me too often. And so we work with the patient advocates to think about feasibility. And then we work with the patient advocates to think about accrual. How do we reach the patients that we need? Our expectation is that our patient advocates are working with their advocacy groups, whether it's a disease-specific group or a cancer-specific group or whatever group they're working with, in order to educate the public, educate their advocacy organizations about a particular trial, and help us to accrue the right patients to the right trials. And Laurel, you've been a long participant in our review process. I think maybe you should say a few words, as you are exemplary and have, through years of curiosity, really delved into the research process and concept development process. What are your thoughts?
I have done that, and I started off as a patient, just a patient who didn't know much about ovarian cancer. And because I felt like I had a stake in it, I felt like I needed to learn more. So I set out to make that my job, to learn more about ovarian cancer and cancer in general. And as the time went on, I worked toward that goal, and I feel like I've made strides. But for the advocates who are watching this, who are new to the committee, I would suggest that you not be intimidated by a committee, because you are the person who is representing the disease process or the patient perspective. Most of the people on your committee are people who are not really involved personally with cancer. They're more involved from a scientific side, from a statistical side, from areas that are not necessarily impactful for those patients. However, you, as the patient advocate, have a voice and you have the set of skills that you can represent a patient and the patient perspective. And your lens, as the lens you look through, is so important, because that makes it more realistic for patients. And then it helps the researchers as far as being able to move forward and put together a concept, a research concept that may well go through to the National Cancer Institute, where then it would possibly be approved. We have a high approval rate of our concepts, and I think that's in part due to our advocates. And so we don't work in a silo. We work with our committee chair, and we have to become very familiar with our committee chairs. And I'm very familiar with Dr. Bruner, who I now call Deb, and she does not mind that. And I'm happy to be part of this research group and part of moving research forward. And I hope that we can encourage the chairs of the research committees to then in turn reach out to their advocates, as our advocates intend to be involved in those committees. So if they're somewhat shy or unsure and don't understand research that much, they do understand the patient perspective.